As we approach fall 2025, one thing is clear. The landscape of vaccine recommendations has become a complex maze that can leave even the most informed individuals scratching their heads. With federal agencies revising guidelines and shifting priorities, how do you know what's best for your family? And this is where it gets tricky, because conflicting advice from health authorities can create confusion rather than clarity. Let's break down everything you need to know about vaccines in an easy-to-follow way, so you're equipped with reliable information heading into flu season and beyond. COVID-19 vaccines, a shifting landscape. When it comes to COVID-19 vaccines, recent developments have sparked debate among experts. For instance, while the Centers for Disease Control and Prevention, CDC, continues to recommend vaccinations for adults, its stance on children and pregnant women has evolved. In May, Secretary Kennedy announced via social media that the CDC would no longer universally recommend COVID-19 shots for healthy kids or pregnant women without underlying conditions. Instead, parents are encouraged to consult healthcare providers to weigh the pros and cons based on individual circumstances. But here's the part most people overlook. The Food and Drug Administration, FDA, is currently reviewing Pfizer's authorization for use in healthy children under 5 years old. If revoked, this could leave some of our youngest vulnerable to gaps in protection unless other options emerge. Meanwhile, Moderna's vaccine remains limited to children with pre-existing medical issues, and Novavax isn't yet approved for those under 12. Despite these changes, organizations like the American Academy of Pediatrics, AAP, maintain that all children aged 6 months and older should still receive the primary 2-dose series, along with annual boosters akin to flu shots. Dr. Anders Pring emphasizes that nearly half of pediatric hospitalizations due to COVID-19 occurred in otherwise healthy children between October 2022 and April 2024, underscoring the importance of vaccination, even for those without known risk factors. For expectant mothers, maternal-fetal medicine specialist Dr. Naima Joseph strongly advocates for receiving the vaccine during pregnancy. This not only protects the mother, but also helps pass critical antibodies to the developing baby. Insurance coverage remains another layer of complexity. Although companies are required to follow CDC Advisory Committee recommendations, temporary guidance from professional societies will suffice until final decisions are made. On a positive note, America's Health Insurance Plans, AHIP, representing insurers nationwide, has pledged continued support for accessible and affordable vaccines. We aim to ensure equitable distribution, says Dr. Joseph, highlighting ongoing partnerships with clinicians and community health workers. Flu shots. Steering clear of controversy. The flu vaccine remains a cornerstone of preventive care, recommended annually for everyone aged 6 months and up. However, controversy brewed earlier this summer when the CDC advisory panel decided to phase out thimerosal, a mercury-based preservative found in multi-dose vials from certain formulations. While anti-vaccine groups have long linked thimerosal to autism, extensive research has debunked such claims. Thankfully, manufacturers assure that removing thimerosal won't disrupt supply chains. Less than 5% of U.S. flu vaccines contain this ingredient anyway, meaning accessibility shouldn't suffer. Institutions like Boston Medical Center remain vigilant, proactively managing inventory to guarantee sufficient stock throughout the season. SRV, vaccinations, protecting our most vulnerable. Respiratory syncytial virus, RSV, might sound unfamiliar, but it poses significant risks to 2 key groups, infants and seniors. Typically mild and healthy adults, RSV can lead to severe complications in young children and older adults with compromised immune systems or chronic lung conditions. To combat this, the CDC now advises RSV vaccines for adults over 75 and those aged 50 to 74 at heightened risk. Additionally, newborns benefit from monoclonal antibodies like clesrovimab and nirsevimab, which safeguard against infection during their first months of life. Pregnant women are urged to consider Pfizer's Abrysvo vaccine between weeks 32 and 36 of gestation, allowing protective antibodies to transfer to the fetus before birth. Experts unanimously agree that RSV immunizations play a vital role in shielding high-risk populations from serious illness, pneumonia prevention, year-round vigilance. Finally, let's talk about pneumonia, a condition that disproportionately affects young children and older adults. The CDC endorses pneumococcal vaccines for kids under 5 and adults over 50, as well as individuals living with chronic illnesses like asthma, diabetes, or HIV/AIDS. Dr. Cassandra Pierre notes that these vaccines are readily available year-round, making them convenient for routine checkups. By staying current with immunization schedules, families can significantly reduce the likelihood of severe respiratory infections. Where can you turn for trusted guidance? With misinformation rampant online, finding credible sources is more important than ever. Professional bodies like the AAP and AMA offer evidence-based insights tailored to different demographics. Local public health departments also serve as hidden treasures, providing region-specific updates and resources. In July, the University of Minnesota launched the Vaccine Integrity Project, in collaboration with leading medical associations, aiming to streamline flu, COVID-19, and RSV immunization strategies. Yet, doctors stress the value of personalized consultations, urging patients to engage openly with their healthcare providers. Pediatricians thrive on building relationships with families, says Dr. Pring. We're here to guide you every step of the way. So, what are your thoughts? Do you feel confident navigating today's vaccine recommendations, or does uncertainty linger? Share your perspective in the comments. We'd love to hear from you.